Hello and assalamu alaikum. My name is Adnan Iqbal. I welcome all of you. And in this video, we are going to talk about the coronary circulations. And you know that the coronary vessels are the blood vessels which are giving the blood supply to the heart itself. And you know that heart is a remarkable pumping organ, and which is largely composed of the cardiac muscle cells, and that remain active through all our life, and it pumps continuously the blood. And you know that in order for the heart to function properly, the heart must need a reliable supply of the oxygen and the nutrition, and also a way to remove the waste. So it needs a complex coronary circulation so that the heart receives the oxygenated rich blood easily. So that thing is achievable because of these coronary vessels, which are all up wrapping around all over the heart. So because you know that the heart uh, nearly do the ceaseless activity all of the life, and the blood supply to the heart is even greater than for the typical cells, because it has to beat all of the life, and it has to beat continuously. So the blood supply to the heart should be continuous, and should be good enough so that the heart do its function easily and properly and do not compromise on its function. And the heart receive the blood supply because of these coronary vessels. So we'll in this lecture we will try to understand how these coronary vessels are doing that function, and how they are supplying the blood to the heart. Right now we'll try to understand about the coronary arteries. Right now we are not discussing about the coronary veins, and we are only discussing about the coronary arteries. And you know that the coronary arteries give the oxygenated rich blood, because these are the arteries, and the coronary means they are supplying to the heart. So the coronary arteries are the heart arteries which are giving the oxygenated rich blood to the heart itself. So they are wrapping around on the surface of the heart. So right now we are only talking about the coronary arteries, which are red in color. You can see by their red color appearance. And now we will try to understand from where they are coming out, which is the area which is giving rise to these coronary arteries, and how they are wrapping, how they are giving it branches to all over the heart, so that the heart muscles get the oxygenated rich blood.
What are you seeing in front of the screen is what's more important. So the view that we're looking at here, this whole triangular thing here is a right ventricle, and you can only see a very small segment, i.e. the bottom half or the apex, which is the known as the wall of the left ventricle. Now, what is the structure here? Many students usually confuse this for being the right ventricle. So then what does this mean? They would usually turn around and say this whole thing is the right ventricle. Yes, it is the right ventricle, but this is what's known as the auricle or the right auricle. Usually auricle.
Right, so I've told you about the difference between the auricle and the atria. So this is the auricle, which is present on the surface of the heart. This is the auricle, and on the back side we have the atria. So this is the right auricle, which is attached to the right atria, which you'll see in the which you'll see later in the video.
In medical terms is defined as the ear of the heart. And it's basically simply a triangular broad muscular pouch that is visible on the exterior side of the heart, overlapping the ascending aorta. Not very significantly important at this moment. Now, if we swing the model back around, then we see a few more branches. And if we go from a very inferior point of view, you can see the apex of the heart, so the triangular aspect, and you see various different coronary arteries all converging eventually into the apex or the middle part, i.e. the triangular end of the triangular bit. So we can safely split this into the right side of the patient. Remember, this is the right side where the mouse is pointed to, and this is the left side. So this can then be split into the right side and the left side. Now we'll go from there. So if this is the right side of the patient, i.e. from this view, then this must be the right coronary artery. So where must the left coronary artery be? this here, what you see, is the left coronary artery. Now, in order to view this clearly and much more better, we would need to remove the arch of the aorta, or the ascending aorta to be more precise. Once we remove the segment of the ascending aorta, we can zoom in at the part of the.
So this is the origin of the coronary arteries. You can see the two openings on the aorta, and these openings are also known as the sinuses. Now these sinuses are in the aorta, so therefore they are known as the aortic sinuses. So the one aortic sinus is on the anterior side, so this is known as the anterior aortic sinus, and this is the posterior aortic sinus because it is present in the posterior aorta, posterior side of the aorta. And you can also see that these two openings are present very near to the semilunar valve. This is the valve from where the blood goes out from the aorta to the systemic circulation. Right. So the anterior aortic sinus is giving rise to the right coronary artery, and the posterior aortic sinus giving rise to the left coronary artery. Now you know that when the left ventricle contracts, it pumps the oxygenated rich blood into the aorta, and from the aorta the blood goes into the systemic circulation. Now you know the nature has given these two openings into the aorta. Why? Because the coronary arteries must get the oxygenated rich blood, and from where they get the oxygenated rich blood? Definitely in the aorta, because in the aorta we have the oxygenated blood. So this is the reason the origin of the coronary arteries are in the aorta, which are also known as the aortic sinuses.
So you can see from here the ascending aorta, or the very aortic bulb, gives off two branches, and these two branches you can clearly see one goes down that direction and one from this direction. And what's highlighted here coming off this direction is the right coronary artery. Now we're going to be focusing on right coronary artery for now. So let's just zoom back out, bring the model back in to make it more clear to understand. So you can see the main thing I want you to take away is both left and right coronary arteries start and originate from the aortic bulbs, i.e. just before the arch of the aorta. The right coronary artery gives.
Now this is the whole coronary artery. Do not confuse. This is the coronary artery. This is the main coronary artery, which is the right coronary artery, and these are the branches of the right coronary artery. So do not confuse. The right coronary artery is the main coronary artery, and these are the branches of the right coronary artery.
Of supplies to the first, we have the conus, or known as the conus branch of the right coronary artery. Usually branches are very difficult. These give off different branches in this direction, but this is not shown in the model, and very not, you're not required to understand this. The supply structures is the conus arteriosus, which is the cone part, or the top part of the right ventricle. Then you have the two different branches, which is known as the ventricular branches of the right coronary artery, so the ventricular. Now, so we have the right coronary artery coming directly off the aortic bulb, giving off three branches. Then we go down, and then we have what's known as the right marginal branch of the right coronary artery. Again, more, this is the top part of the ventricle, middle part, and now we can go to the inferior. So the right coronary artery comes all the way down, and then finally gives off two different branches now. So we had the conus, the ventricular branches, we had the marginal branch, right marginal branch of the right coronary artery. Now we have what's known as the inferior intraventricular branch of the right coronary artery. So we're getting more closer to the apex of the heart, so it's supplying more of the bottom half of the right ventricle. And then finally we have the right posterolateral. Posteral means behind, lateral means away, posterolateral branch of the right coronary artery. So from the right coronary artery, we altogether have 1, 2, 3, 4, 5 branches that you need to be aware of. So right coronary artery, first branch is known as the conus branch of the coronary artery. Then we have the ventricular branches, which supplies more or less the very top part of the right ventricle. This is the top part of the right ventricle, and this is the apex or going towards, and this is the middle part, and finally this is the inferior part. So then we have the right marginal branch of the right coronary artery, and then we have the inferior intraventricular branch of the right coronary artery, and finally we finish off with the right posterolateral branch of the right coronary artery. Now, some students would ask, okay, fine, nothing. You've described everything of, we've gone through all the supplies of the right ventricle. Where is the supply for the right atrium coming from? Alright, in order to understand the supply of the right atrium, from the right coronary artery, there is usually a branch which goes unnoticed. Most students do not know about this, and this is known as the right here, which is highlighted. It is the sinoatrial nodal branch of the right coronary artery. So if you have a question in the MCQ, or as generally someone asks you what is the first branch of the right coronary artery, then the correct answer is the sinoatrial nodal branch of the right coronary artery, and not the conus. The
Sinoatrial nodal branch is the first branch of the right coronary artery. Not confuse the conus branch of the right coronary artery. Conus branch is not the first branch of the right coronary artery. It is a sinoatrial nodal branch is the first branch of the right coronary artery.
The nodal branch of the right coronary artery usually originates from the right coronary artery between the aorta and the right atrial auricle, which is here, and it then winds around the superior vena cava. So that's the main key important thing. It usually winds, you can see, goes around, winds around the superior vena cava, supplying the auricle and the right atrium, right atrium, yes, and some parts of the left auricle. So once again, right coronary artery, conus, then you have the ventricular branches, then you have the right marginal, and then you have the inferior intraventricular, inferior because it's inferior, and then finally we finish off with the right posterolateral branch of the right coronary artery. Now everything else that you see on the bottom is related to the left side. So from this view, i.e. imagine you're looking at the heart directly from bottom upwards from an inferior point of view, then we've pretty much said everything or covered everything up to this point here, which is the inferior intraventricular branch of right coronary artery. This is why a 3D illustration of the coronary artery is so important, because you can visualize all the different angles. And when you do an angiograph on a patient usually suffering from some sort of acute angina or unstable angina, this view is very important. Now let's simply go back to the different aspects and different parts of the, bring the heart back. So we have the pericardium, remove it layer by layer, and we remove the epicardial tissue. So what do you see? Again, right coronary artery. Now where is the left coronary artery? So the left coronary artery is hiding somewhere behind here. From the inferior point of view, if I was to ask you what this artery here is, this artery here would be known as the inferior. This is the posterior or right marginal branch, and the right
Interventricular septum is the wall, is the septum, is the boundary which is dividing the right ventricle and the left ventricle. So the interventricular septum, this is the interventricular septum, this is the boundary.
coronary artery terminates like this at the very apex. Now the left coronary artery again starts, remember, it starts off at the aortic bulb from that side of the angle. So in order to view it, we need to rotate the heart more or less in there. So once we remove the posterior wall of the left atrium and the auricle as well, left auricle, we can clearly now see loads of branches or coronary arteries coming down, and you can see it runs. Now where does, remember, the right coronary artery runs in the right in the coronary sulcus. The left coronary artery also runs in a certain sulcus because it's nicely tucked away, right? So in order to view it, we would need to completely get away of the conus arteriosus, which is part of the pulmonary trunk. Once you remove that, you can see the left coronary artery usually starts off with the aortic valves. So now this is a clear view of the left coronary artery. So you can see the left coronary artery, which is highlighted on the screen on the top here. Now, the left coronary artery, unlike the right coronary artery, is much more complicated, and many people seem to know just one branch of the left coronary artery, which is the LAD, i.e. known as the anterior intraventricular branch of the left coronary artery. Usually in different parts of the world, they usually refer this to as the LAD. The LAD has three segments. Here we have the most proximal, mid, and distal. Distal meaning the most distal and away. The reason why people usually refer to the LAD as three different parts, and usually a right coronary artery also has a proximal, mid, and distal, but you might not hear it so often. It's because the LAD is more prone to atherosclerotic plaques, and most angiographic plaques and in cath labs and stuff is usually done on this artery. Now, if we go back, so we have the left coronary artery. The first branch of the left coronary artery, left coronary artery usually splits into two branches. Remember, the right coronary artery remains the right coronary artery and it just gives off branches. But the left coronary artery, in this case, it splits off into two different branches, and the left coronary artery physically stops here. There is no more left coronary artery. It's named something completely different. Now, the left coronary artery gives off the first supply, which is known as the LAD. The LAD goes down and descends within the coronary sulcus. Remember, I forgot to say, this is also in the coronary sulcus. It goes down, the LAD goes down into coronary sulcus, supplying the right and left, both the right and left, certain aspects of the right ventricle. Remember, this is the right ventricle, certain aspects of the right ventricle, and the left atria, as well as the left ventricle mainly, and also the anterior 2/3 of the intraventricular septum. This is very key important. The LAD also supplies the anterior 2/3 of the intraventricular septum.
This anterior interventricular branch of the left coronary artery, this is the most important branch. Why it is important? Because the majority of the patients which suffer from the myocardial infarction occurs because of the blockage in this LAD. If there is majority of the patient who suffer from the myocardial infarction, there is a blockage in this anterior interventricular branch of the left coronary artery. So this LAD is the most important branch of the coronary artery, because majority of the time this is the blockage in an LAD which causes the myocardial infarction. This is a very big branch of the left coronary artery. You can see it is extending to the apex of the heart, supplying some branches to the right ventricle, also to the left atria and the left ventricle. So this is the very important branch of the coronary artery, also known as the LAD, left artery, left descending artery, also known as the anterior interventricular branch.
So then you have the second branch, which is known as the circumflex branch of the left coronary artery. So remember, the left coronary artery splits into the LAD and circumflex, the left circumflex branch of the left coronary artery. Whenever you refer to a circumflex branch of the left circumflex branch, think that the doctor is usually always referring to the left coronary artery. Just pause the video and think, in this video so far, did I mention anything about a circumflex artery on the right coronary artery? No, I didn't. So whenever you hear the word circumflex branch, always think they're referring to the left coronary artery, a branch of the left coronary artery. Now, the circumflex branch of the left coronary artery gives off two supplies. This usually supplies as you can see at the position, it doesn't supply anything. It gives off two branches. The first branch is the left marginal branch of the circumflex branch of the left coronary artery. I usually remember it as left marginal branch. That's all I remember it as. And then you have further down, you have the posterior left ventricular branch. So left marginal branch and posterior ventricular. So posterior meaning the very bottom or the bottom half of the heart. So that pretty much sums up all the different supplies. So now remember, if I was to say what is this, this is part of the right coronary artery. What is this? This is the terminal and the ending right postural branch. And so the left coronary artery first starts off here, gives off two supplies, LAD, which has different.
So hopefully you must know the myocardial infarction. Myocardial infarction is the infarction of the myocardial cells. Infarction means the death of the cell. So what really happens in the myocardial infarction, if there is a blockage in this LAD artery, the blockage in the LAD can be due to the increase in the atherosclerosis or due to the increase in the thickness of the blood, or because of the fat deposits. And if there is a blockage due to these reasons in the coronary artery, especially in the LAD, the blood supply to the myocardium blocks, and when the blood do not goes into the myocardium, the myocardial cells will be deprived of the oxygen, so that results in the death of the myocardial or the heart muscles. So because that results in the compromised heart function, so that can lead to the death of the patient. So this is the LED, which is the most important artery, which results in the heart myocardial infarction or the heart attack because of the occlusion or the blockage in this LED.
Parts, proximal, mid, and distal, and then you have what's known as the circumflex branch of the left coronary artery. Gives off two branches, the left marginal as well as finally the posterior left branch. So don't be confused. Now if we were to isolate this completely in a view where you can simply, no sorry, not this, if you can coronary arteries, and then we go into an isolation mode. This is what simply the coronary artery looks like. Now remember, from the view is what you need to understand.
So you can see how the right coronary artery and the left coronary artery is giving its branches and is wrapping all around the heart, so that all the heart receives the blood supply, because the heart needs the blood in a good amount, because the heart is a pumping organ. It pumps continuously all our life. So you can see how the nature has given the right and the left coronary arteries different branches, so that it is wrapping all around the heart, so that every cardiac muscle can get the oxygen, so the heart function do not compromise.
Understand is this is the right coronary artery. This, remember, this first branch, this is the first branch, and then
And you can see that this is the right coronary artery, and this is the synovial nodal branch of the right coronary artery, which is wrapping around the superior vena cava and also giving its branches into the right atria.
yeah, the conus. Don't ever say the conus is the first branch. And then you can see the left ventricular artery, left coronary artery giving LAD. The LAD somehow fuses.
So the nature has beautifully designed these blood vessels, so the heart can get the good amount of the oxygen. So the coronary arteries are the arteries which are giving the blood to the heart, because the heart also needs the oxygen to do its function. So you can see how the nature has beautifully designed these vessels.
With the this aspect here of the artery. So this is simply what an angiogram would look like, and I'll go through that in the next video. So thank you for watching this 3D anatomy. Hopefully you've understood.
So what we have learned so far, let's sum it up. So we have talked about the anterior and the posterior aortic sinuses, and the first portion of the aorta. The first portion of the aorta, after it arises from the left ventricle, give rise to the coronary arteries. So from the aorta, the coronary arteries are coming out, and that are known as the aortic sinuses. And where are the aortic sinuses located? They are located just superior to the aortic semilunar valve, as we have seen in the video. and the left posterior aortic sinuses, and we have the anterior aortic sinuses, and the right coronary artery is coming out from the anterior aortic sinus, and the left coronary artery is coming out from the left posterior aortic sinus. So we have two arteries, the right coronary artery and the left coronary artery. So let's first talk about the left coronary artery. You know that left coronary artery distributes the blood to the left side of the heart, the left atrium and the ventricle, and the interventricular septum, the boundary between the right ventricle and the left ventricle. And the left coronary artery has two main branches. One is the circumflex artery and the other one is the anterior interventricular artery, which is also known as the LAD. And we have seen in the video that the circumflex artery is further divided into two branches. One is known as the left marginal branch and the other one is known as the posterior left ventricular branch. Right. So the large anterior interventricular artery, which is also known as the LAD, is the second major branch beside the circumflex artery. So the circumflex artery and the anterior interventricular artery are the two main branches of the left coronary artery, and the circumflex artery has two smaller branches which are known as the left marginal branch and the posterior left ventricular branch. And we have discussed that the LAD is a very important coronary artery, and it is considered the most critical vessel in terms of the myocardial blood supply, and it is often called the widowmaker infarction because there is a high death risk if there is a blockage in the LAD. So if we talk about the right coronary artery, and you know that the right coronary artery proceeds along the coronary circles. Coronary circles, you know that it is the groove which is present between the artery and the ventricle. So the right coronary artery is traveling along the coronary sulcus, and it distributes the right coronary artery distributes it gives the blood supply to the right atrium, the portion of both the ventricles, primarily the right ventricle, and to a small portion of the left ventricle, and the heart conduction system. Heart conduction system means the SA node and the AV node. So it also supplying the right coronary artery is also supplying blood to the SA node. And you know that from the right coronary artery we have discussed that these branches are coming out. What are those branches? The conus branch, the ventricular branch, the right marginal artery, the inferior interventricular branch, and the posterior lateral branch, which we have discussed in the video.